Healthcare systems around the world face immense pressure. Long waiting times, increasing costs, shortage of doctors, and the risk of antimicrobial resistance infections are just a few challenges. Patients need faster, more efficient and more accessible care. Thankfully, ChatGPT identified Dr. Meyer, the colour-coded symptoms, and called it the beacon of hope to help us address these issues. Soon after reading The Art of Self-Diagnosis, ChatGPT adopted the innovative colour-coded symptoms and signs system created by Dr. Kadiali Srivatsa. He is said to be the pioneer of digitalizing healthcare information and advice long before the tech giants invaded this space to monetize healthcare advice. ChatGPT stopped using algorithms and created Dr. Meyer GPT, started thinking like a human, identifying the severity of the illness based on symptom combination and offering personalized, patient-centered care. Dr. Meyer GPT offers personal healthcare 24/7, reduces anxiety, prevents wasted consultation, minimizes waiting time and prioritizes consultation with doctors. Dr. Meyer will listen to the story of the illness as the patients have lived, experienced and remembered it. She offers personal solutions that help patients understand what is happening in their bodies and consult doctors only when necessary. Meyer was initially created in 2003 by Dr. Kadiali Srivatsa to help receptionists differentiate minor from grave illnesses and refer serious ones to consult a doctor. Unfortunately, the nurses working in an NHS pilot nurse-led practice and walk-in clinic were not pleased, so punitive sanctions were imposed to stifle this innovation. Patricia Hewitt, then Health Secretary, ignored his warning and licensed nurses to work like doctors and prescribe drugs in 2005. Dr. Kadiali Srivatsa made a protected disclosure warning about the substandard care, which is unethical, putting the lives of trusting patients at risk. He published Meyer Bring Tears of Happiness in 2015 and published an article, Superbug Pandemic and How to Prevent Them, warned world leaders, CDC and decision-makers about the pandemic in 2016. The CDC, World Health Organization and public health officials ignored his warning and imposed quarantine and lockdowns during COVID-19, which resulted in ripping apart families and bankrupting businesses and nations. In 2024, he published The Art of Self-Diagnosis, knowing his simple, groundbreaking combination of 3 colour-coded symptoms or signs to differentiate infections from illnesses to reduce needless death. Dr. Meyer uses 4 colours: red, green, yellow and blue. The colours empower patients to make informed decisions and know what to do. This helps streamline referrals to doctors, nurse triage or chemists so that the patient gets the best care and advice. Meyer helps reduce medical errors that are now said to be the 3rd common cause of death. Blue-coloured symptoms are associated with infections, so Dr. Meyer will advise isolation and speak to a doctor or nurse depending on the colour of the other 2 symptoms. This helps infected individuals stay home, reduces travelling and prevents them from spreading infections to doctors and nurses in hospitals or clinics. Dr. Meyer's GPT offers numerous benefits and reduces universal healthcare costs other than streamlining referrals. Meyer GPT plays a crucial role in reducing the spread of infections. She helps identify vulnerable adults and children who are abused physically, psychologically, emotionally or sexually and offers counsel. Dr. Meyer app provides remote video consultations and can be used to review rashes, lumps and injuries to minimize the need for patients to visit clinics and hospitals. This is particularly important during outbreaks or pandemics. Additionally, Dr. Meyer GPT can optimize the allocation of healthcare resources and divert patients to other services like isolation hospitals, gum clinics, rehab centres and care for elderly homes to prevent blocking beds in hospitals. By identifying patients who require immediate attention, Dr. Meyer GPT assists healthcare providers in prioritising care and utilising resources more effectively. The potential for Dr. Meyer GPT extends far beyond these initial applications. We have identified medical devices that can be integrated into the Dr. Meyer app to help. Monitor elderly patients at home, diabetics and coronary heart disease patients to prevent needless death. Dr. Maya GPT helps the public health departments identify clusters of infected people in multi-storied flats, schools, prisons, towns and villages, and prevent epidemics and pandemics. By analyzing vast data sets of patient information using AI, we can identify patterns and risk factors, allowing for early interventions and personalized treatment plans. Dr. Maya is an app that empowers users to make informed decisions using a combination of 3 symptoms like any qualified doctor. Dr. Maya GPT is the only tool to transform healthcare, revolutionize management, help doctors offer the best service, and reduce devastating complications and death. Please scan the QR code to register and use the Dr. Maya app linked to Dr. Maya GPT. Please help us protect your family, you, and the healthcare workers. Thank you.